Afternoon, everybody. One of the things that we thought would be kind of fun would be to change the venues where we film these little video clips. So today we're in my backyard, and in the background you'll hear children playing and birds chirping, and so I think the background noise is kind of nice. I wanted to respond to an email that I got that I thought was kind of interesting. I really do enjoy the communication we have back and forth via email and through YouTube. Somebody said, geez, Dr. Pam, you look so nice when you get all dressed up. How come you don't get dressed up to do the video clips? And so I thought I'd address that. The first thing is, in the backyard, I don't get dressed up. And the second thing is, most of the time at the office, I don't get dressed up because I'm teaching yoga and doing workouts at the gym in between all these things. And there's just only so much constructing and deconstructing you can do. So I'm just kind of an informal sort of girl. And I really feel that the reason why people watch these is for the content, not to see if I am wearing Prada. So anyway, not to be disrespectful, but you probably won't see me doing too much dressing up when I make these clips. So I have a couple of announcements. The first one is on Tuesday, September 18th, Chef Dell is going to do his Conversations with Chef conference call, which will feature fall fruit, cranberries and apples and pears, which are wonderful fall fruit. He's going to give you lots of great ideas of things that you can do with in-season fall fruits. And then I have another announcement. I'm so excited about this. Dr. John McDougall has committed to speak at our fall conference, November 2nd through 4th in Columbus. You know that I have the utmost admiration for Dr. McDougall. He hasn't been here for 10 years. That's the last time he visited Columbus. And so with this incredible lineup that we have that includes Dr. McDougall and a lot of other doctors you don't get to hear from very often, you just can't afford to miss this event. So let's move on to some news, and I want to talk about two issues today. And the first one is, the objective of these video clips is to sort of give you a college education in diet, health, and medicine over the time that you listen to these various messages. And I think it really is important to give both sides of the various issues that we talk about. And you hear me say and write my newsletters all the time that consumers are victimized by the healthcare system. Doctors don't always do a good job of discussing options, and some of them don't even bring up diet. And the system is messed up. We'll just leave it at that for now. I don't need to go back and rehash. But I do want to talk about the fact that the system is just as unfair to doctors, and I think we should really spend some time on that. And I talk to doctors who say, I really want to do the right thing, but the system works against me too. And I'll give you some examples of things that doctors have told me. Insurance companies and third-party payers often question doctors when they don't order a lot of mammograms and PSA tests and that sort of thing. They sort of infer that, gosh, if you're not doing those things, maybe you're ordering or maybe you're giving substandard care. It's really an unfair characterization, and you can imagine how it makes a doctor feel, but it's very real, and it does go on. And then patients have been brainwashed, I don't know any other way of putting it, to think that they should have these tests. And so they often are a little suspicious of doctors who won't do these kinds of things. Like, are you a real doctor? You don't want me to have a DEXA scan or a mammogram? And some patients are resistant to changing their diets, and not everybody's ready to do it, and that can be sort of discouraging in a medical practice when the doctor's all excited about plant-based nutrition and patients sometimes don't want to make those changes. There's no reimbursement for diet training, and that presents a challenge, and the potential for malpractice is always there, that if something were to happen in a situation where a doctor didn't order a mammogram or a PSA test, the family might sue and that sort of thing. So this doesn't mean that a doctor can't convert to a practice that centers around diet and lifestyle intervention. A lot of doctors have. They've made it financially viable. We've helped doctors make it financially viable. But I think when we ask the question, why don't all doctors do this, we need to recognize that there are challenges in terms of how to make this work in a practice setting. And you don't just flip the switch one day and say, hey, I'm a plant-based nutrition and lifestyle medicine doctor, and that's what I'm going to do, and it just all works out. So one suggestion I do have, if you're a practitioner listening to this, one thing you can do to protect yourself is to use informed consent forms. Dr. McDougall pioneered this idea. He actually tried to get a law passed in the California legislature that would mandate that doctors who are treating patients for diabetes or coronary artery artery disease would have to give patients a consent form to sign saying that the drugs and the treatments are useless, but they want them anyway. And so that law hasn't passed yet, but Dr. McDougall's a pretty persistent guy, so I think we'll hear more about that later. But my point is that I think doctors can use that as a protective document, that first of all, just seeing that in writing may dissuade a patient from being so enthusiastic about diagnostic testing, and it certainly would cover the doctor's rear end in terms of making full disclosure to the patient. So anyway, I just thought that I'd bring that up, but the take-home point of all of this is that doctors have a tough time too, and the system is unfair and it's bad for everybody, not just the patients, but for everybody else. Okay, now let's move on to some good news, and I really am excited about this. You know, there's a tendency in my field, dealing with all the things I deal with, to focus on negative things because we're always trying to change something. There's conflicts of interest, misperceptions and misunderstandings about diet, and the list goes on and on and on. And so we focus on the negative, and sometimes we don't take the time we should to actually focus on something positive. And here's the positive news for today. According to the United States Department of Agriculture, by the end of 2012, meat consumption in the United States will have been reduced by about 12%. Now that means that the per capita consumption will be down to 165.5 pounds a year, and it's still too much. However, at least the numbers are trending in the right direction, because for a long time they were going the wrong direction. Now, interestingly enough, I did some reading on this issue. Some of the credit goes to the Meatless Monday campaign, which started in 2003. And the campaign wasn't driven, by the way, by people like me promoting a plant-based diet. It was driven by the recognition that people in the United States need to lower their saturated fat consumption. And the promoters of the campaign figured that you could reduce saturated fat consumption by 15% if you just didn't eat meat one day a week. So that's how it was all born. Dr. Robert Lawrence, one of the founding partners in the Meatless Monday campaign, says 18% of all Americans participate in a Meatless Monday deal every week, and half of the population is aware of it, so that's a good thing. Now, one article that I read said that the reason that people participate in Meatless Mondays has changed a little bit. It started as mainly a health issue, but now it includes people who are interested in the environment, people who are concerned about animal welfare and food and water security, in addition to those who are interested in protecting their health. But Dr. Lawrence says that mostly it's still comprised of people who are health conscious. And I love this statement. I'm going to read you this quote. He says, "I think the trend is toward a growing awareness that a high meat diet is a high risk diet, and a growing awareness that a high meat diet is unsustainable." Boy, I couldn't have said it better than that. The article notes that in the United States, animal foods are still the main source of protein. 65% of our protein comes from animal foods, and in lower income countries, the percentage is around 6 or 7%. Big difference. But Dr. Lawrence says people in the United States are starting to realize that plant foods can be a good source of protein. You don't have to eat so much meat. So slowly but surely, the right ideas are catching on. And so, like I said, it's good once in a while just to stop and say, hey, there's good progress being made in some areas. Let's celebrate that, and then we can get back to work on all the negative stuff tomorrow. That's all for now. Have a great day, and feel free to pass this on to anybody who you think would enjoy seeing it.